I'm going to cover a topic that isn't often covered in high blood pressure lectures, and that's something called pulmonary hypertension. Pulmonary hypertension is a series of diseases. It can be pulmonary venous hypertension or pulmonary arterial hypertension. The scary disease is pulmonary arterial hypertension. We usually pick this disease up on echocardiogram. There are a couple of treatments for pulmonary hypertension. Remember that pulmonary hypertension is not a great disease to have, and it can result in death. Now, we first started using what is now called Viagra or sildenafil for children who had pulmonary hypertension. And how Viagra came to be is we noticed these little babies, these little neonates had erections, and some enterprising physician somewhere decided, hey, this would be a great drug for adults to take. That's how Viagra came to be. We have well-tolerated treatment for pulmonary hypertension with a phosphodiesterase type 5 inhibitors or PD5 inhibitors. It causes direct pulmonary vasodilation. How it works, of course, for erectile dysfunction is because the pulmonary blood vessels are kind of similar to the blood vessels in the penis in terms of a pharmacological perspective, they both cause dilation in those vessel beds. There's a new agent that is also a PD5 inhibitor. It is cheaper, but it does have more side effects. Now, the mainstay of treatment of pulmonary hypertension are the endothelin receptor agonists. Depending on where you are, there are 2 or 1 ERAs in practice today. Bosantan is the prototypical drug. We also use prostaglandin active agents. These work through PGI2, and they're considered the most effective therapies as well. Now, in terms of memorizing things for exams, I think the one that you want to really remember is bosantan. If you remember prostacyclin, that's added bonus, but the questions are going to be focusing on bosantan.